I got out of the bed. I couldn't push up on my own on the bed because you have to be careful of your sternum. And there were a couple of nurses there making sure I was. Then when I sat down, it was, we showed you how to sit down, this is how we want you to do it, because there's a natural reaction to reach out with your hands. And the staff here were trying to teach me how to not use techniques that caused pressure on my sternum.
Let's talk about your sternal precautions. Your sternum, or your breastbone, has been cut in half. And just like every broken bone, takes time to heal. Your sternum takes about 8 to 12 weeks or 3 months for the bone to heal. Your surgeon has placed wires around it to hold it in proper alignment, and these wires stay in place forever. It is very important that these wires stay in place so your bone can heal properly. This helps your sternum to heal quickly, prevents infection, and decreases the risk of the sternum separating. For the next 8 to 12 weeks, you need to avoid any pushing or pulling with one hand, such as using a cane, any lifting, pushing, or pulling anything heavier than 5 pounds, which is roughly a 2-liter carton of milk, not even a 4-liter jug. If you need to lift something that's greater than 5 pounds, we recommend you picking up the object with both hands, keeping the elbows close into your body, and carrying the object close to your stomach. This causes the least amount of stress on your sternum. Some everyday examples of things greater than 5 pounds: opening and closing car doors, carrying grocery bags, heavy laundry baskets, taking out the garbage, lifting heavy pots and pans while cooking, picking up pets and grandchildren, and walking pets on a leash. You also want to avoid laying on your stomach, as you need to do a push-up with your arms to get yourself up. Avoid any reaching out to the side, behind you, or reaching anything up into the air. This can get tricky when you're getting dressed. This is why we recommend wearing loose, stretchy t-shirts or button front shirts. It's best to keep your arms facing forward when getting dressed. For putting on a t-shirt, gather the head hole of your t-shirt in your hands and slip your head through. Place your arms through the sleeves by bringing your arms forward and not out to the side or overhead. Repeat on the opposite side. To pull the shirt down over your torso, cross your arms, grasp the shirt, and wiggle down. To remove the shirt, it's the same process but reversed. A button-up shirt or jacket, you hold the shirt with the tag facing away from you. With your elbows close to your body, flip the shirt behind you over your shoulders so it rests on your shoulders like a cape. Use the same technique as done with the t-shirt. Use your crossbody arm to hold the sleeve open and push your arm straight through. Repeat on the opposite sleeve. To remove the shirt, it's the same process but reversed. When washing or combing your hair, keep your elbows close to your body. Raise and lower both arms at the same time. Tucking your neck down will prevent you from having to raise your arms too high. After a bowel movement, reach underneath and wipe from front to back. Or one can slouch forward, reach around from the side, but always avoid a twist to the back. When getting into a car, open the car door with both hands if someone isn't available to assist you. Back your knees up to the seat and sit down. Walk your feet and your buttocks around so that you're facing forward. Use your cross body arm to grab the seat belt, pass it to your opposite hand, and buckle up. If you're traveling home in a truck or a tall vehicle, we recommend your family brings in a step stool, as you won't be able to use a handle to boost yourself into the vehicle. Step onto the stool, sit on the seat, and then swing your legs in. You're not allowed to drive for 6 to 8 weeks after surgery. Your vehicle insurance will not cover you during this time period, and you'll need to be cleared by your family doctor before you drive again. You should avoid any vigorous sporting activities for at least 3 months. This includes activities such as tennis, swimming, golfing, chopping wood, shoveling snow, anything that has the big twist. If you have any activity that you're concerned about or eager to get back to, always consult your doctor first. Many people live outside of the Kelowna area. When traveling home, we recommend you stop about every hour to hour and a half to get out and walk around for about 5 minutes. Sitting for prolonged periods of time can cause blood to pool in your legs, which increases your risk of blood clots. This also is important to remember when you are recovering at home.
Sternal precautions at home were pretty darn easy, because when I didn't follow them, I would get a very quick, sharp reminder from my chest that I shouldn't be doing that.
Balancing rest and activity is key. So make sure you're getting up, moving around your house every hour or two, increase circulation, prevent blood clots, and help prevent fluid accumulation in and around your lungs. It's important to continue your seated exercises twice a day for the next 8 to 12 weeks. This prevents any shoulder stiffness and maintains your leg strength. Start with 5 repetitions of each exercise and work your way up to 10. These exercises should be pain-free, and use a supportive chair with a good back support so you can sit with a nice upright posture and continue breathing normally throughout. The exercises are as follows. Neck range of motion. Perform a chin tuck by moving your head backwards. While your chin is in the tuck position, turn your head to the left and right and then repeat. Shoulder range of motion. Raise your shoulders upward towards your ears and roll backwards. Always move your shoulders together at the same time, as this helps stabilize your sternum. Return to the start position and repeat. Shoulder raises. Place your hands together in front of you with your elbows straight. Raise your arms together, only going to forehead height at most, and then return to the start position. Hamstrings. Sit on a chair with your knees bent, one leg at a time. Straighten your leg and hold it in the air for 10 seconds. Lower your leg and repeat with your opposite leg. For your ankles, sit in a chair with your feet flat on the floor. Raise both feet up while keeping your heels on the floor. Lower and repeat.
To get into bed, you're first going to lay down on your side. You are allowed to use the arm that goes across your body to support yourself on the way down. Do not use your elbow. Bring your legs in as you are lying down or at the end. To roll onto your back, use your legs by digging your heels into the bed. To get up, it is the same thing but reversed. Roll over using your legs, swing your legs over the side of the bed, use your cross arm and your legs to push or walk your way up into sitting. Most importantly, do not use your elbow, as that increases the risk of your sternum pulling apart. To stand up from a chair or from the bed, you're first going to wiggle your way closer to the edge. Once your feet are close or touching the ground, you're going to tuck your heels behind your knees and you're going to lean forward. Leaning forward is going to help you to get your bum off the bed without having to use your arms to help you. At discharge, you will be given a red heart pillow to replace your blue pillow. That is going to be there with you for the next 2 months to help protect your sternum and follow your sternal precautions.
We didn't have these right away. We had just another pillow sort of thing. But the whole idea was you would hold yourself, and that added support to the sternum. And the other thing it did is it took your 2 hands away from pushing yourself up or down off the arms of the chair. But so often this was the important thing.
It is very important for your recovery at home to continue and build up upon your walking program. Walking improves cardiac health. It decreases the incidences of post-op complications.
You have to walk. If you don't walk, you get clots in your legs, or liable to get clots in your legs. But because again I knew it and I didn't feel like walking, doesn't matter, it was part of the therapy, so I did it. Obviously day after day after day I got stronger and stronger and stronger.
We recommend you start with 5-minute walks and increase that by 2 minutes every day, with the goal of getting up to 30 to 60-minute walks most days of the week. You should start your walking program on a flat ground, gradually incorporating hilly challenges into your program as your strength and your endurance improves. How hard you exercise is determined by the talk test. If you are finding you cannot walk and talk, then you need to slow down. If the weather conditions are not ideal outside, you can use your house or your apartment. Gyms, rec centers, grocery stores, shopping malls are also good options. If you're exercising and you experience any of the following symptoms, you should stop and rest. Pain or discomfort in your chest, neck, jaw, arms, back, excessive sweating, irregular heartbeat, extreme and sudden shortness of breath, feeling cold and clammy, or an unusual fear or apprehension. If any of these occur, stop the activity that you're doing and rest for 15 to 20 minutes. If they continue past the 15 to 20 minutes, go to your hospital or call 911.